Hi, Duncan Ferguson again. This is the third of 3 units on managing infectious of selected organ systems in dogs and cats, and we're going to focus on respiratory, neurological, and orthopedic indications in this unit. Again, my disclaimer, and you'll find basically what we're doing here is looking at the odds, and we're trying to select the appropriate antimicrobials based on their characteristics against bacteria that are likely to be a problem. Culture and sensitivity as always should take preference. And I would have you go back to the second unit to look at what I wrote down in this similar slide on the suggestion that you use Target, which is a reference that by David Aucoin and distributed by Bayer, that helps you look at least in a population of the actually around the United States of ANTAC laboratories, the bacteria that are being cultured and the sensitivities that are being developed. First, we're going to talk about pneumonia, and although they're not the most common, actually gram-negatives are more common, we're going to talk about gram-positives first. And in this category, we're going to see that our alpha and beta hemolytic strep are common in pneumonia, staph, and for these, we would choose the following drugs: cephalexin, the cephalosporins, trimethoprim sulfa, potentiated aminopenicillins, and the quinolones or amoxicillin or ampicillin by themselves. And these are, as I said, not the most common bacteria, at least in the United States, with regards to pneumonia. So what are common in pneumonia? First of all, that you can say in many cases there's no predictable bacterial pathogen, therefore culture and sensitivity is highly indicated. Whether you take a transtracheal wash or whatever to get this result. In cats, Bordetella and Pasteurella are common. And the key here is that 2/3, at least in the United States, are gram-negative and often resistant against commonly used antimicrobials. So while we're waiting for results, we can look at the likelihood that these gram-negatives, some of them are going to be E. coli, that we have trimethoprim, chloramphenicol, or quinolones are rational choices for pneumonia. What about bronchial infections, where you need a little bit more penetration into the bronchial tissues? Again, we look at lipid-soluble drugs, and I've listed them for you here: quinolones, chloramphenicol, macrolides. These get pretty good penetration. When the secretions are very severe, please note that using aminoglycosides are highly charged. They don't tend to get in and penetrate secretions very well. They don't work very well in that case. If you suspect anaerobes, consider clindamycin and metronidazole. And if you have evidence of mycoplasma, clindamycin or tetracycline. Let's turn to the central nervous system. The key factor here is lipid solubility. And we generally think about those agents that are lipophilic, such as chloramphenicol, sulfas, sulfatrimethoprim, metronidazole, and the quinolones. Of course, anytime initially in a CNS infection, there's likely to be inflammation, and then inflammation will allow other drugs to get in during that infection, so the blood-brain barrier is less of an issue. What about orthopedic indications for antibacterials? Well, firstly, prophylaxis is considered to be reasonable and rational treatment here because of the length of even sterile orthopedic surgeries. So these are high-risk surgeries. A bone infection resulting from a mistake or even just environmental contamination could be quite serious. So generally, you will use some drugs such as cephalosporins or relatively safe drugs that you can use in this situation to get to bone tissue. With known infections, of course, this is serious, and so culture and sensitivity of whatever fluid you can get, joint, the wound, the bone itself are important. And key is the length of your treatment needs to be quite long because these are very, very difficult infections to manage. So what about known osteomyelitis? The bugs that tend to come to the bone and reside there are staph, strep, E. coli, Proteus, and Pseudomonas. So for those that are gram-negative, like E. coli, Proteus, and Pseudomonas, consider the aminoglycosides, although their penetration won't be that great, and then the quinolones. And then for gram-positive, and just as these are generally used for prophylactic treatment in bone infections, so could also clavulanic acid amoxicillin or oxacillin. And imipenem is sometimes suggested for this. However, because of concerns over preserving such a drug for really serious infections, this probably should be reserved till the very last choice. And then for penicillinase-producing staph, oxacillin and cloxacillin.